Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Lagos sets up strategy committee to monitor travelers into the state as part of efforts to prevent a third wave of COVID-19. Kano State battles vaccine hesitancy as number of second dose seekers reduces. And fully vaccinated Britons travelling in from medium-risk countries no longer to quarantine following negative test result within 2 days of arrival. The World Health Organization has asked countries to be cautious when lifting COVID-19 restrictions. Michael Ryan, WHO emergencies head, said countries must be careful not to lose the gains made. This is as the global vaccine distribution scheme COVAX says it aims to deliver 520 million COVID-19 vaccine doses to Africa this year. The managing director of COVAX, Aurelia Nguyen, told News Today that COVAX had been in talks with the Indian government and Serum Institute and that it was factoring in a resumption of supplies from India towards the latter part of the year. Meanwhile, in Nigeria, the highest daily count was reported since the week began. Lagos recorded the highest positive samples, with other states recording new infections. Let's find out more.
The global death toll from COVID-19 has surpassed 4 million, and over 185 million cases have now been confirmed, according to data from the Johns Hopkins University. While the pandemic is not over yet, the World Health Organization is asking countries to be cautious when lifting COVID-19 restrictions. The WHO emergencies head stated this at a recent media briefing, where he reiterated that countries must be careful not to lose the gains they've made so far.
The idea that everyone is protected and it's kumbaya and everything goes back to normal, I think right now is a very dangerous assumption anywhere in the world, and it's still a dangerous assumption in the European environment. There are a lot of gains have been won over the last number of months. Many countries have suffered. Even the high vaccination countries have suffered. Their health systems have suffered. We need to think about what we truly value.
In Nigeria, the Nigeria Center for Disease Control and CDC announced 110 new cases reported from 6 states and the FCT in the last 24 hours, the highest daily count reported since the beginning of the week. Lagos was the most impacted with 88 new cases, followed by Rivers with 12. Akwa Ibom had 4. 2 cases were recorded in Jigawa and Ogun, while 1 case was recorded in Kano and the FCT. The latest update also includes 0 cases from Ekiti, Imo, Kaduna, and Sokoto states. The total number of confirmed cases in Nigeria now stands at 168,110. 3 people have been discharged in the last 24 hours, raising the total number of recoveries to 164,408. Presently, there are 1,580 active cases in the country, while over 2.3 million samples have been tested so far. The latest update by the National Primary Healthcare Development Agency shows that more than 2.5 million eligible Nigerians have received the first dose of the COVID-19 vaccine, while over 1.3 million persons have been fully vaccinated. More than 75% of vaccines supplied have now been administered across countries in Africa, while there are over 5.6 million confirmed cases and more than 146,000 deaths on the continent.
The Lagos state government says it is well prepared to manage the scare of COVID-19 third wave. The State Commissioner for Health, Professor Akin Abayomi, says the mandatory 7 days isolation is a strategy that will help detect any traveler who comes into the state with a new strain of COVID-19 from any of the high-risk countries. He says a large number of people will be returning to Lagos from Europe for their vacation, and so it is important that the COVID-19 guidelines be strictly adhered to by everyone.
The reason for the immediate test is so that we can minimize the exposure of these travelers to anybody, and also to give us the opportunity to identify what type of strains are coming into Lagos and that's what we describe as genomic intelligence. It is important that we have a clear understanding of which of these COVID-19 new strains are trying to enter our community. This 7 days mandatory isolation has given us the opportunity to prevent or to slow down the advent of a third wave. We are expecting a large number of children returning from Europe for the summer vacation. We know that the mutant strains are circulating in Europe, and therefore these sanctions are very important. The schools are important also. We have got a heightened surveillance around our schools to make sure that when there are symptoms of COVID-like illness, that these children are quickly tested and their family members are tested, and this activity is ongoing as we speak. This is important to make sure that we interrupt the opportunity for the virus to spread within the schools and also for children to take the virus home.
Well, the Commissioner for Health, also in Lagos, Professor Akinbayomi, gave an update on the funeral activities for the founder of the Synagogue Church of All Nations, Pastor T.B. Joshua, emphasizing that the state government will be monitoring the ceremony to ensure that the crowd is well controlled, not exceeding 200 international visitors. Earlier this week, Professor Akinbayomi led a delegation to inspect facilities at the church for COVID-19 safety and prevention protocol compliance in readiness for the funeral rites.
We had been expecting a large number of people to come into Lagos for these week-long series of activities at the synagogue, but we've been able to reduce the number of people coming in for this event significantly. As I speak, the list will not exceed 200 international visitors, and all these visitors will go through the normal rules and regulations of isolation for 7 days before they participate in any of the week-long activities at the synagogue. The Ministry of Health is embedded at the synagogue to make sure that there is day-to-day compliance at any of their activities. Like I said, the Lagos State government is very aggressive with its third wave prevention strategy. We may not be able to escape it, but we certainly hope that it will not be a severe third wave and that we will be able to flatten the curve as we have done both in the first and the second wave. There's nothing unique about Lagos or Nigeria. Every other country is going through the same experience, and therefore it is important that we are aggressive about minimizing the impact in Lagos State.
Away from Lagos, Kano state government was amongst the first states to receive the COVID-19 Oxford AstraZeneca vaccines in March this year, and the state governor, Abdullahi Ganduje, flagged off the immunization campaign afterwards. Our correspondent, Nanchin Vincent, gathers that over 100,000 people have received the first dose of the vaccine. However, the numbers have dropped with the administration of the second dose. Let's find out why.
The outbreak of COVID-19 got the health sector seeking ways to provide a cure for the devastating disease. However, with the innovation of vaccines for prevention, the world could heave a sigh of relief. Kano has been proactive with the administration of vaccines, but some have not come forward to get the jab.
I've been busy and I've not been having time. Though if I have the time, definitely I will take it. But more reason they say you have to have it before you travel. But for now, I don't have traveling plans.
People do say they will not take it, that it's not real. You understand? So I believe it's not necessary.
Kano received 219,690 doses from the first installment of vaccines to the country. These were distributed to 229 health facilities across the state.
We were able to immunize 106,588 cumulatively because the 219,690 doses we received is actually for both first and second doses.
But it appears enthusiasm had waned when it was time for the second dose.
There were a lot of social media videos, short clips that are circulating with so many conspiracy theories about this vaccine. We had to do a lot of mobilization to ensure that people get sensitized, people get educated about the efficacy and the safety of this vaccine.
Those who took the vaccine narrate their experiences.
Because we handle patients every day and they might come with a positive result, so we need to protect ourselves.
Health authorities in the state say sensitization efforts should be ramped up to counter rumors of the vaccine which are being spread through social media, pointing out that the spread of the virus is seen to reduce in places where more vaccination is taking place. From Kano Metropolis, Nanchin Vincent, Channels Television News.
And we're staying in Kano, our studio there, where Dr Amino Erde is the Managing Director, Unicare Hospital Limited. He joins us at this time. Thank you for joining us on the program. I'd like to begin with asking your thoughts on really the major cause for you why there appears to be a drop in residents in Kano completing their second dose of the AstraZeneca vaccine.
Thank you very much. Actually, there is a lot of conspiracy theory going on about this corona vaccine. And, you know, many people, they tend to believe in things that are really unreal. So this could explain why the second dose of the vaccine is being shunned away by several individuals.
Would you say that there is a possibility that they might not meet their target of completing the 2 doses, and Kano might have a case where, you know, some of the vaccines might expire if these are some of the reports coming in at this time?
Well, it's not likely because there is a lot of campaign going on. The media houses are telling people the reality of the situation, and the government is making a lot of effort to see that those who have received the first dose have actually come back for the second dose of the vaccine.
Looking at the vaccination plans, that's on the one hand. When it comes to bringing down the virus, COVID-19, mitigating its impact, especially community spread, what's your take on the attitude, human behavior, especially with regards to the safety measures?
Well, actually, people tend to forget so easily. Despite the devastating effect this virus has caused on human lives and the economy, people are, you know, they tend to be forgetting that this virus is still with us. It has not gone away, and we have to still continue with our public measures, the non-pharmacological methods of controlling the virus. That is social distancing, use of face masks, hand washings. They are very important, especially now that it has been proven the use of face masks greatly reduces the rate of infection, especially where social distancing is not practical.
Lagos State is, you know, putting lots of measures, strategies to avoid another wave. How optimistic are you that Kano can indeed avoid a third wave of COVID-19?
I am very, very much optimistic because virtually every adult in Kano is now aware of COVID-19. COVID-19 has prevented many people from traveling for this year's Hajj, and I'm sure that is an indicator for them that we still have the virus and it could still resurface and stage the third wave.
All right, lots of optimism there, and we hope that, you know, it continues that way. We appreciate your time. Thank you so much, Dr. Amino Erde, the Managing Director, Unicare Hospital Limited, Kano. Thanks for joining us on the program.
Thank you very much.
The United Kingdom has announced changes to international travel as the global death toll from the coronavirus surpasses 4 million. The policy only applies to those jabbed in the UK, so those jabbed abroad will have to quarantine if coming from an amber list country. Tests are also still required from green and amber list countries. Well, here's more on the global update.
Thank you, Madam Deputy Speaker, I don't underestimate for a second.
The announcement on changes to international travel was made by Britain's Transport Secretary, Grant Shapps, in Parliament today. He says fully vaccinated Britons returning from medium-risk amber list countries will no longer have to isolate when they return home from July the 19th. The change means that while travellers will need to take a COVID-19 test before travel and within 2 days of arrival, they will have to they will not have to isolate if they receive a negative result. The government regards a fully vaccinated person as anyone who received their second dose of vaccine more than 14 days previously. The Japanese Prime Minister says the number of infections is rising in Tokyo area due partly to the Delta variant of the coronavirus. This comes as the government decided to put the capital under the fourth state of emergency over COVID-19, covering the duration of the Olympics in an effort to curb a recent surge in infections. Spain is focusing on boosting its vaccination campaign to counter a COVID-19 surge across the country and to attract tourists. It comes as French junior minister advised French people today to avoid Spain and Portugal for their summer holidays due to risks tied to the highly contagious COVID-19 Delta variant. The national infection rate, as measured over the past 14 days, has soared to 252 cases per 100,000 people as at Wednesday. Finally, the United States is exposed to new coronavirus fighting challenges following the Independence Day holiday due to high passenger flow, low vaccination rate and slackened awareness of anti-pandemic measures. While the country continues to lead the world in the numbers of both confirmed COVID-19 cases and related fatalities, some experts say the country may find itself confronting another wave of infections following the celebratory weekend holiday.
Well, we have more stories in Nigeria, this time not central Nigeria, Plateau State. It has exhausted over 100,000 doses of the AstraZeneca vaccine allocated for vaccination in the state. According to the state's primary healthcare board, 67,601 persons received the first dose of the vaccine, with 31,271 receiving the complete doses of the Oxford AstraZeneca vaccine. Now, having administered the available doses allocated to the state, the super sites or centres earmarked for the exercise are empty as government awaits the next batch of vaccines from the federal government.
Initially, we received about 105,600, then we received another batch of 5,000, but we gave out some of the vaccines to Gombe State, and when they needed some, and we returned some to the national because of the expiry date then. But we were replenished with about 5,000 more doses onto the initial dose that was given to us. So, and it is that we have exhausted. Even this morning, some people came in to say they want to take the vaccine. Unfortunately, we don't have the vaccine. And there are some people that had even taken the first dose but have not returned to take the second dose. However, we had to start re-administering to some people that are taking the first dose. So, pending the arrival of the next batch of the vaccine delivery, which we are hoping to get at the end of this month, as assured by the National Primary Healthcare Agency, either end of this month or early next month, we'll commence the second phase.
Well, let's go now to the southwest Oyo State, where the state's COVID-19 task force has warned that the virus is still very much within the society. It's warning residents of the state to continue to comply with all advisories aimed at curtailing the spread of COVID-19. It equally admonished residents to continue to embrace the initiative, and that is OYA, on your action that was introduced by the state government at the peak of the pandemic, urging them to stick to the guidelines of wearing the nose and face mask in public gatherings, washing of hands with soap and water, the use of hand sanitizers where, of course, water and soap are not available, and the other measures, physical distancing as well. Mr. Taiwo Adisa, who is the Chief Press Secretary to the governor, quoted the task force as saying that it has reported a few cases of COVID-19 over the past 10 days. The statement also records that the state's task force headed by the governor, Seyi Makinde, took insightful actions and introduced policies to pinpoint including the release of advisories on the prevention of the spread of the virus, as well as food advisories to boost the immune system. It says that the task force has reported is rather working on curtailing the spread of infections, including the NPIs, and that is the non-pharmaceutical intervention, which it says is extremely important. And we're back to the World Health Organization Director General, Tedros Ghebreyesus, who said that the world is at a dangerous point of the COVID-19 pandemic. He says this is due to the fast-moving variants, he calls it, as they continue to spread because of uneven global vaccination efforts. He made the comments as the world passed the grimstone of 4 million recorded COVID-19 fatalities, more than 18 months since the outbreak emerged in China in December 2019.
The world is at perilous point in this pandemic. We have just passed the tragic milestone of 4 million recorded COVID-19 deaths, which likely underestimates the overall toll. Some countries with high vaccination coverage are now planning to roll out booster shots in the coming months and are dropping public health social measures and relaxing as though the pandemic is already over. However, compounded by fast-moving variants and shocking inequity in vaccination, far too many countries in every region of the world are seeing sharp spikes in cases and hospitalization. This is leading to an acute shortage of oxygen treatments and driving a wave of death in parts of Africa, Asia, and Latin America. Vaccine nationalism, where a handful of nations have taken the lion's share, is morally indefensible and an ineffective public health strategy against a respiratory virus that's mutating quickly and becoming increasingly effective at moving from human to human. At this stage in the pandemic, the fact that millions of health and care workers have still not been vaccinated is abhorrent. Variants are currently winning the race against vaccines because of inequitable vaccine production and distribution, which also threatens the global economic recovery.
Now, irrespective of the COVID-19 variants, the virus is more likely to spread when people gather without public health and social measures. Let's all continue to take responsibility. You can visit our website for more updates, a better understanding of the pandemic. You'll find there the top story, and that is the grim milestone of 4 million deaths. And this is as outbreaks surge in Asia. There's several other stories there. It's on channelstv.com. It's at your fingertips. Program this evening. Thank you for watching. I'm Millicent Wonwoka. Stay healthy.